Hello, my name is Jessica Simmons, and I will be presenting on the poster for Gaining Insights into Urinary Tract Complications by Investigating the Prevalence of Mucus and Sediment in the Urine of Intermittent Catheter End Users with Spinal Cord Injury. The primary objective of the study was to investigate the prevalence of mucus and sediment in the urine of spinal cord injured patients who managed their bladder through intermittent catheterization. We know that spinal cord injury significantly impacts the bladder function, often requiring intermittent catheterization for bladder management. Microorganisms introduced into the urinary tract while performing intermittent catheterization can lead to urinary tract infection. Patients with history of spinal cord injury experience urinary tract infections at the rate of 2.5 events per patient per year. Mucus and sediment found in urine, while nonspecific symptoms, can be associated with risk factors of symptomatic urinary tract infections. This study aimed to provide insights into the complications such as UTIs that are associated with intermittent catheterization in this population. The methodology regarding this study included 166 participants. They were aged 18 years and older with a history of spinal cord injury. They came from the United States, Canada, the United Kingdom, and France. This study data was collected from cross-sectional surveys that were distributed through patient support programs from the US, Canada, and the UK, as well as distributors of continence care products from the US and France. 61% of the participants reported performing intermittent catheterization for at least 3 years, and 95% of those reported catheterizing at least 3 times per day. The data was summarized using standard descriptive statistics for categorical outcomes, which is essentially frequency and percentage. 33% of patients had reported being diagnosed with 2 or more urinary tract infections in the previous 12 months. 28% of patients had noted observing mucus in their urine, and 22% of them had noted seeing it on at least a monthly basis. Among those with 2 or more urinary tract infections in the last year, 40% of them had noticed mucus in their urine. 51% of patients had reported seeing sediment in their urine, with 42% of them encountering it at least on a monthly basis. Among those with 2 or more urinary tract infections in the last year, 69% of patients saw sediment in their urine. On the other hand, among those with 2 or more urinary tract infections in the last year, only 16% of patients had reported seeing neither mucus nor sediment in their urine. The findings indicate a notable prevalence of mucus and sediment, more so with those experiencing a urinary tract infection among spinal cord injured patients using intermittent catheterization. This underscores the need for enhanced clinical monitoring and targeted interventions to mitigate any complications, thereby improving the overall quality of care for spinal cord injury patients. Thank you very much.